important, very important subject, which is lymphoma. Okay. What is it? What is lymphoma? Lymphoma is malignant neoplasm of lymphoid or reticuloendothelial origin. Okay, it's a malignant neoplasm of lymphoid tissues or reticuloendothelial origin. Okay, what's the incidence of the lymphoma? Lymphoma is a common disease. Nearly 53,000 cases per year. 53,000 cases per year. Non-Hodgkin lymphoma is 5 to 6 times more than Hodgkin lymphoma. You have two types of lymphoma, Hodgkin and non-Hodgkin. Non-Hodgkin. Non-Hodgkin is 5 times more than Hodgkin lymphoma. Lymphoma causes 23,000 deaths per year. 23,000 death mortality per year. Hodgkin disease, what is it? Hodgkin disease is histological diagnosis based on recognition of red Sternberg cell اللي هي mirror image cells تذكرونها. يعني هذا الهوجكن ديزيز اللي هاي السيل يصير mirror image cells. giant cell هكذا بها النيوكليوس mirror image. mirror image cell. It is present in Hodgkin lymphoma only. Hodgkin lymphoma أو يسموها red Sternberg cell اللي هي multi-nucleated giant cell. multi-nucleated giant cell. This is multi-nucleated giant cells اللي هي red Sternberg cells, or they called it Dorothy red cell also. That is اسمها mirror image mirror image cell. Okay. How do patients with Hodgkin disease usually present? طبعا 60% present with asymptomatic lymphadenopathy, just lymphadenopathy. Presentation of Hodgkin disease, asymptomatic adenopathy, lymphadenopathy, 60%. Which nodes are initially involved? اللي هو أكثر النودز اللي involved cervical من 65 to يعني من 65 to 80% cervical lymph nodes. Axillary lymph nodes axillary lymph node 10 to 15%. In the guanal region 10%. Guanal region 10%. Mediastinum initially involved in 50% of cases. How is disease separate? طبعا separate via شنو؟ lymphatics. Via lymphatics. Metastasis occur in a predictable pattern to contagious nearby lymph node if this is lymph node involved. Okay. If this lymph node involved, it will come through the lymphatics to other lymph nodes. Okay. To nearby lymph node. Okay. How is diagnosis made? Biopsy of involved lymph node. Biopsy. Okay. Cervical or axillary, the largest and the most centrally located node should be selected for excision. Those with only mediastinal involvement should have mediastinoscopy or thoracotomy to obtain biopsy. يعني بالنسبة للميدياستينال. Otherwise, in cervical or axillary or any prominent lymph node, the central one, the largest one. What are the appropriate steps in the initial workup of patient with possible Hodgkin disease? شو سوي؟ شخصنا Hodgkin disease. What to do? Initial workup with patient with the Hodgkin disease. أولا complete history and examination. History and examination. The patient should be carefully evaluated for symptoms of adenopathy. سوي CBC with يعني complete blood count. Complete blood count with the platelet and differential diagnosis. Differential count. The platelets. نشوف شنو نشوف نورموكروميك نورموسيتيك انيميا اللي نلاحظه يطلع عندنا نورموكروميك نورموسيتيك انيميا. اوكي. نورموكروميك نورموسيتيك انيميا. بعد increase neutrophil and eosinophil. increase eosinophils. platelet normal. later leukopenia and thrombocytopenia. later شو يصير عندنا بعدين؟ leukopenia and thrombocytopenia. ESR renal and liver function test. alkaline phosphatase هاي مهمة أيضا نسويها. renal function test, liver function test, alkaline phosphatase, LDH, lactase dehydrogenase. والانزيمز يعني يوريك اسيد، سيرم كوبر. بايوبسي قلنا، وبعدين شو نسوي؟ راديولوجيكال ستدي. راديولوجي راديولوجيكال ستديز اللي هي تشيس اكس راي، تشيس اند ابدومينال سي تي. تشيس اكس راي، chest and abdominal CT scan. When are lymphangiogram indicated? Lymphangiography indicated when CT negative bipedial lymphangiogram may be helpful in evaluation of retroperitoneal and pelvic lymph nodes in preparation for surgery خاصة. lymphangiography شو يسوي؟ bipedial يعني من الطرفين السفليين يصعد الليمف وهكذا يروح من الليمف لمفاتكس إلى retroperitoneal lymph nodes فيصير evaluation يعني lymph nodes involvement مثلا. بعد more sensitive than lymphangiogram more sensitive specific C يعني and more specific than CT. I can detect non-enlarged node with structural defects. What is staging laparotomy? سامعين اللابروتومي يصير هذا بس what is staging laparotomy? Staging laparotomy what is it? هي اللابروتومي to distinguish between low stage and advanced stage. It is staging. Low stage. الفرق بين low stage إلى advanced stage. هذا هو low stage laparotomy. staging laparotomy. Midline abdominal incision. Examination of liver to rule out disease. Biopsy of the free margin of right lobe, true cut needle biopsy 3 times of both right and left lobes, and biopsy of any suspicion lesion. هذا اللي يسويه بالستaging laparotomy. staging laparotomy. midline incision, examination of the liver for metastasis or for an involvement, biopsy, surface biopsy, edge biopsy يعني من الرايت لوب، وكور biopsy 3 core biopsy from right and left lobes of the liver, and suspicious area. بعدين نسوي سبلينكتومي. and send for biopsy. والهايلر lymph nodes biopsy of هايلر lymph nodes اللي موجودة بالهايلم of سبلين. اوكي. and clipping يعني الفيزلز clipping of splenic vessels. حتى شو يصير؟ clipping by metal clip with the radio opaque, which is radio opaque clip. أقدر شنو for follow up. okay. بعد other mesenteric lymph nodes, celiac, mesenteric, نير بنكرياتك مثلا المنطقة بارا أورتك، إلياك. زين abdominal lymph nodes كلها لأن كلهن ناخذ لهم بايوبسي اوف any suspicious area. اوكي any suspicious area شفناها بالليمفانجيوغرام انجيو او شفناها بالسي تي. وكل نودز كل مكان ذي النودز اللي نعقده لازم شو نسوي له؟ نأشره براديو اوبيك كليب or area radio opaque clip except for mesenteric lymph node which may be more considerably during subsequently X-ray for radiation therapy. اوكي بعد نسوي bilateral bone marrow biopsy bilateral bone marrow biopsy from iliac crest و ovarobaxy surgical fixation of ovary خاصة patient in childbearing age with ovaries marked. Okay, then what we do again after bone marrow biopsies, ovarobaxy. Exhibit a surgical fixation of ovary in childbearing age. Ovarobaxy. Okay. We marked it with metallic clip. Okay. نثبتها للبلفيك side wall of the pelvis. If this procedure is anatomically impossible, the ovaries are secured behind the uterus for the protection from the radiation. Okay. Prior to staging laparotomy, what prophylaxis must be patient receive? لأنه الستيجنج لابراتومي بسبلينكتومي ايش لازم نعطي؟ the patient should receive vaccination pneumovax, meningococcal vax and hemoinfluenza vax. Pneumovax, meningococcal vax and hemoinfluenza vax. When is staging laparotomy indicated? Staging laparotomy indication مالته شنو؟ It is controversial. Low clinical stage 1 and 2 اللي هو 20% of stage 1 and 30% of stage 2 patients have occult subdiaphragmatic involvement, which would be alter the therapy when found on the laparotomy. Those patients who will receive chemotherapy as a primary treatment modality, يعني more than stage 3. فإذا تهمنا الستيجنج يهمنا بالتريتمنت، يعني الستيجنج دايجنوسيس هو ستيجنج لابراتوري، بس يهمنا بالتريتمنت بعد والبروجنوسيس ايضا بعد والتايب اوف تريتمنت whether surgical radiotherapy or others. والفكرة إن ليش صارت؟ لأنه stage 1 or 2 قلنا نشوف نسبة منهم وين يصير involve سبلين زين، وهذا كان not be diagnosed without staging splenectomy. بعد improvement of imaging and more liberal use of chemotherapy making staging surgeries less common. طبعا بعد التحسنات بالMRI والسي تي سكان يعني نقدر نسوي مثلا سي تي ستيج، يعني قللت عملية الستيجنج لابراتومي. شنو الريسك اوف ستيجنج لابراتومي؟ بعضها يعني morbidity less than 0.5% اكو morbidity mortality أصلا بوينت minimal morbidity and mortality شنو less than 0.5%. الريسك include مثلا post splenectomy sepsis ذول اللي هم early age especially encapsulated organism 10% not pre-treated with the pneumovax vaccine يصابون في 10% من هؤلاء بالoverwhelming post splenectomy sepsis. بعد increased occurrence times of secondary acute non-lymphocytic leukemia. Acute non-lymphocytic leukemia, especially in those who receive alkylating agent chemotherapy, 9 times greater risk. هذا risk مال الستيجنج لابراتوري. أولاً البوست overwhelming post splenectomy sepsis for those who didn't receive vaccine. The second increased risk of acute non-lymphocytic leukemia خاصة ذولي especially who take alkylating agent. How we define the following stages according to the Ann Arbor staging classification of Hodgkin disease. Staging classification of Hodgkin disease. Staging Hodgkin. Stage 1. Stage 1. Staging Hodgkin disease. Stage 1. Stage 1. Stage 1. 2. Stage 1. Single lymph node, or extra lymphatic region. Just single lymph node or extra lymphatic region. Stage 2, 2 or more than 2, a group of lymph node on same side of diaphragm. Stage 3, both sides of diaphragm involvement. Okay. Stage 4, diffuse, disseminated, visceral involvement. Stage 4, diffuse visceral involvement. وممكن نضيف لها A B C. فالA يعني asymptomatic. الA asymptomatic. الB symptomatic, weight loss more than 10% in 6 months. Fever. الB weight loss more than 10% in 6 months. Fever greater than 38 centigrade و9 sweats. Night sweats. B. Stage E, extranodal. E, extranodal metastasis or extranodal presentation of the Hodgkin. What are the 4 histological types of Hodgkin disease? The histology of Hodgkin disease. أولا nodular sclerosis. Mixed cellularity. Type. Lymphocyte predominant. والأخير الموزيان اللي هو lymphocyte depleted اللي هو بالبروبوسيس. lymphocyte شنو depleted. What's the most common histopathological type? The most common histopathological type, nodular sclerosis. Which type has best prognosis? Prognosis lymphocyte predominant. Very good prognosis. Which type has worse prognosis? Lymphocyte depleted, worse prognosis. What treatment are used for various stages of Hodgkin disease? Stage 1 التريتمنت stage 1 إلى 2A. زين external beam radiotherapy، هذا radiotherapy radiation. اوكي stage 1 إلى 2A. stage 3A or above okay, more than 3A. combination chemotherapy احيانا راديوثيرابي. Okay, are radiation therapy and chemotherapy ever combined in treatment of Hodgkin disease? Yes, ممكن. إذا bulky mediastinal disease بالbulky mediastinal disease شو نسوي؟ combined therapy chemo and radio. What percentage of patients with Hodgkin disease are cured? Nearly 80% cured. 80% of Hodgkin disease cured. Thank you very much.